just going around the state and letting everybody be involved and hearing how concerned, but not just concerned, we're hearing from real people that their life and death matters are at stake here. The people that have nothing, will have nothing if this is gone. Make no mistake about it. The poor will be hurt. Medicaid will be cut. The elderly will be hurt. And basically, if you, God forbid, people that are for the first time getting mental health treatment, getting addiction treatment, they're going to be hurt. And when it's all said and done, $880 billion will be taken away from Medicaid. Then on top of that, they gave a tax cut to $575 billion tax cut for the wealthiest Americans. And just the whole thing, I says, somebody's got to have a moral compass. Somebody has to have a moral compass. This is not right. And it can be fixed. There won't be a person in that room that believes that what we have is perfect. But we all understand if you throw it out, you can't bring it back, because they can throw it out with 51 Republican votes. They need 60 votes to bring it back and fix it. I'm only asking for, don't repeal it. Let's sit down and repair it first, and then see what we have.
We take pride in remaining active members of our communities. We don't deserve to have the rug yanked out from under us. We can't accept any legislation that provides less coverage than what we have now. We can't go back to being denied coverage for pre-existing conditions. I don't go back to being uninsurable. So the politicians are listening. We have one here today. I'm so thankful for that. It just takes all of our voices to be heard. So please keep speaking up for me and for the 24 million who stand with this coverage if the American Health Care Act is passed. And I promise to do the same. Thank you.
Woo! With nearly 30% of West Virginians on Medicaid, the question is they want to feel that their benefits are going to be protected. What do you want to say to them?
Well, the bottom line is people for the first time, Medicaid is going to be cut. People on Medicaid are on Medicaid because of their income levels. The expansion was 100 to 139 percentile of poverty levels, okay? They're for the first time, these people are getting health care, never had it before. It's made the difference all the difference in the world and the quality of life they have. All of that's going to be cut and reduced. They have to understand. The seniors are senior citizens. Now the cap is going to go 5 to 1, so every insurance company will be able to charge a senior 5 times more than what they charge the healthiest young person. Those types of things are just inhumane. It really is.
And do you believe that health care is a basic human right?
Well, we always believe health care is a basic human right. The bottom line is we're paying for health care one way or another. We always have. The sad scenario is we never try to keep a person healthy to prevent them from getting these catastrophic illnesses. There's no wellness involved. There was no pre-planning involved. And now we're able to do that. If you have a health care plan, you can go to a doctor visit, you can get a screening, you can get a test, you can maybe prevent from a serious illness. The way it was before, people had no insurance, just went to the emergency room at the worst time. And it's the highest cost. If you were working and you didn't have an insurance policy where you worked, you would basically use workers' comp. We were using the most expensive form of health care and the least effective. That's what we had before. So is this perfect? No. Can it be better? Absolutely. But if you throw it out, I can tell you the toxic atmosphere that we have in Washington won't bring it back. And then you know it's going to be all politics. Well, it's the Democrats' fault because they didn't vote to bring it back. It's the Republicans' fault because they kicked it out. I told President Trump, I said, Mr. President, you're going down the primrose path. Your colleagues on the Republican side are leading you down the primrose path. Please don't do it. And I said, first of all, they're going to strip all the money away for paying for it. All the taxes will be rebuilt immediately. And then they're going to say, well, we're not going to do anything for 2 years. But they know how drastic these changes will be. They don't want to get the 2018 election. So I said, the bottom line is you're going to have a $475 billion budget hole. You can't let that happen. I said, and people are going to be thrown off unmercifully. And you have said that basically you're not going to put people off or throw people off of insurance. So I've asked everyone, call the White House, call your congressional delegation, call everybody you can. Ask them, please don't repeal, sit down and repair.
And when you told President Trump that, what was his response?
Well, if you recall before, they said, repeal it, repeal it, repeal it. Remember he came out about 3 or 4 weeks ago? He said, we're going to repeal it and replace it the same day. So at least we moved him from waiting 2 years that they were going to do it immediately.
But what was his response to you?
No, his response was basically that we're going to work on it. That's not going to happen. I said, well, if it's not going to happen, you're going to have to get involved, Mr. President, because I can assure you Your colleagues on the Republican side of the aisle are determined to take it away. They're determined, and it's not going to work. And we can fix it. We'll have Democrats that will sit down with Republicans in a very parochial way that we can sit down and find a pathway. The part of the health care bill that really needs repaired, it's the private market system. And then basically, you know, we gave 20 million people extensions of health care that never had health care before. Never gave them one page of instructions how to use their health care. So there's a lot of efficiencies and savings we haven't even tried yet. I'm just saying, come on, work with